Hello. A variety of spacer devices are available to help you use a metered dose inhaler. This video will show you how to use an AeroChamber Plus FlowView spacer. A spacer is an attachment which makes it easier for you to use your metered dose inhaler, especially if you find it difficult to coordinate pressing the inhaler and breathing at the same time. It also helps to get more medicine into your lungs. If you use your inhaler and spacer correctly, you should have better control of your breathing problem. But if used incorrectly, you may have poor control of your condition, with the risk of side effects, such as a sore throat or mouth infection. This type of spacer has a flow view indicator, which is a coloured flap that moves as you breathe in and out of the spacer. The flow view indicator will only move if you've made a good seal around the mouthpiece with your lips. Not all of the AeroChamber range of spacers have a flow view indicator, so check that this is the right video for the spacer that you have. We're going to show you two ways of using your AeroChamber Plus FlowView spacer. If possible, sit upright or stand up when using your metered dose inhaler and spacer. Remove the cap from your inhaler. Hold the inhaler upright and shake it firmly 4 or 5 times. Insert it into the spacer. When you're ready, breathe out gently as far as you comfortably can. Place the mouthpiece of the spacer into your mouth and between your teeth, but don't bite down on it. Close your lips around the mouthpiece to form a tight seal. Press the top of the inhaler down and take one slow, deep breath in whilst keeping your lips sealed around the mouthpiece. You should be able to see the flow view indicator move towards you as you breathe in. After your deep breath in, hold your breath and take the spacer from your mouth. Continue holding your breath for 10 seconds, or for as long as is comfortable. Now breathe out slowly. The green, purple and blue AeroChamber Plus FlowView spacers all have a built-in whistle, which will sound if you breathe in too quickly. Here is an alternative method that you can use, particularly if you find it hard to hold your breath. After putting the mouthpiece of the spacer into your mouth, press the top of the inhaler down and take 5 normal breaths in and out through your mouth whilst keeping your lips sealed around the mouthpiece. You should be able to see the flow view indicator moving as you breathe in and out of the spacer. Watching the indicator move can be used to count breaths for children. Whichever method you use, you need to breathe soon after pressing the inhaler, otherwise the medication will fall to the bottom of the spacer instead of going into your lungs. If your doctor has told you to take 2 puffs, wait for 30 to 60 seconds and then repeat the whole process again using your preferred method. Remember to shake the inhaler between doses. Once finished, replace the cap on the inhaler to keep dust out. If your metered dose inhaler contains a steroid, usually known as a preventer, brush your teeth or gargle with water after every use to prevent mouth infections. It's important that you look after your spacer, and here are some tips. You do not need to wash the AeroChamber Plus FlowView before you use it for the first time, but once you start using it, wash it weekly. To wash, first remove the back piece, then twist the chamber to remove the front piece. Gently wash the parts in lukewarm water with washing up liquid and then leave to soak for 15 minutes. Rinse the parts in clean water. Carefully shake out any excess water, then let the parts air dry naturally in a vertical position. Once the spacer is completely dry, twist the front piece back onto the chamber and press the back piece firmly into place. Make sure that the alignment feature on the back piece is in line with the flow view indicator on the front piece. Your spacer should be replaced every 12 months, but some may need to be replaced sooner. If you're unsure about how to use your metered dose inhaler and spacer, speak to your GP, practice nurse or pharmacist for assistance.